Hello and welcome to my ABCs of Medicare presentation. We're going to make this fast. All my clients are like aunts and uncles to me. I love them and they love me, but they'll come put their hands around my neck if I take too much time or talk in words they don't understand. They don't want to read my book. They don't want to come to a seminar. Bobby, give me the back of the napkin version. So this is what I've come up with over the years. So what we're going to start with is just your Medicare A and B. And then we'll get into some of your options, Medicare Supplement, Medicare Advantage Plan. And then I'm going to have other videos that are going to go into all these different parts, but in deeper detail. So we'll start here with Medicare. So most folks, it's when they turn 65, but also people that have end-stage renal disease, meaning they're on full-time dialysis, or even people that have been on disability for 2 years, on that 25th month, they get Medicare and they're going to get a Medicare card. So Bobby, hey, I see what my card looks like. A much smaller version will come to you though. What's it cost me? Well, you've got Medicare Part A, that's your hospital coverage. Medicare Part B, that's your doctors and outpatient, basically everything else other than being in the hospital. Your Part A is zero because you paid in all these years with paying into Medicare taxes. Part B for 2022 is $170.10. Now, when I first started back in 2010, it was like $109. Creeped up, creeped up, creeped up. This last year, about a $22 increase, the biggest that I've ever seen in my 10 years of doing this. And I'm not happy about it, and neither are my clients, but we'll keep moving. So Bobby, that's my plan. I've got hospital coverage, I've got doctor coverage. I know what it cost me, zero for the hospital, $170.10 for the doctor. What's my benefit program? Well, if you go into the hospital, you're going to give them your red, white, and blue card, and they're going to ask you how you want to pay the $1,556 Part A hospital deductible. Deductible is what you pay first. So you're on just Medicare, you go into the hospital, you come home a few days later, Bobby, I get this $1,500 bill. What is this? That's your Part A hospital deductible, $1,556. That's good for 60 days. So say you're in the hospital a few days, you come home, 35 days later, you're back in the hospital. You're still covered under that $1,556. You go back 3 months later, 4 months later, it's another $1,556. And with Medicare, there's no cap. There's no cap on the amount of bills that you could owe for doctors when you're on Medicare, okay? This is the government insurance plan. This is your red, white, and blue card. This is what you've paid into and what you continue to pay into. On the doctor side, everyone gets to go in for their free Medicare checkup, and then after that, you're going to pay the first $233. That's your Part B, doctor, outpatient, deductible, $233. That's for the year though. Okay, a lot of these employer plans, these Affordable Care Act plans, $2,000, $3,000, $4,000, $5,000, $7,000, $8,000 deductibles. So on your Part B side, $233. You go into the doctor, you're going to pay the first $233. Maybe that's a few doctor visits, maybe it's your first outpatient surgery. Then after that, you're going to pay 20% of the bills. So people think, Bobby, hey, I know a couple years back I got this knee surgery, this MRI, it was like $5,000. You mean I'm going to have to pay 20% of that? Well, no, it's 20% of the Medicare approved amount. Okay, so that same $5,000 MRI may be $600 on Medicare. So someone just on straight Medicare, they've paid their $233, then they'll pay a 20%, pay 20% of that balance. So Bobby, I've got my Part A and my Part B. If you're drawing Social Security, they'll take that $170 out of your check. If not, then they're going to send you a bill. So you're also required to have Part D, which is a prescription drug plan. Part D, your RX plan, they average about $30 per month out of my firm. Some plans will have no deductible, some a little $100, $300, $400, up to $480 deductible. Now, if you're just taking generic drugs, you're really not going to be affected by the deductible on most plans. But if you're taking some of these high-dollar drugs, these name-brand drugs, these especially the drugs you're seeing on TV, you may have up to a $480 deductible. And then you're paying copays on your RX, similar to most plans you're on now. Generic, 0 to 15, Tier 1, Tier 2, name brand, Tier 3, $30 to $40, $50, and then Tier 4, $100 and up. We're going to get into great detail because the drug plan is a very, very specific part of your Medicare plan that you do not want to ignore. We're going to get deep into that with actually 2 videos on your Part D. Part D is by the insurance company. So now you got two cards. You got your red, white, and blue card. You got your drug plan card. Bobby, hey, I'm compliant. I got my Medicare. I know what my benefits are. I got my drug plan. Bobby, I don't take any drugs. I'm not going to pay $30. You're required to have a drug plan or you'll be penalized. We'll get into this in a future video. But nowadays, there's plans under $10 a month. So Bobby, hey, I don't take any drugs. Let's keep you compliant. And we don't want you going and having a surgery. You go to the pharmacy, next thing you know, this drug's $250. I see it all the time. So we got 2 videos coming on the drug plans. So Bobby, hey, I got my Medicare. I really don't like the government being my insurance company. I don't like having to buy a drug plan necessarily because I don't take any drugs. What are my options here? Well, once you get on Medicare, that's the foundation, the red, white, and blue card. Now you have 2 options, Medicare Supplement, Medicare Advantage plans. And I can tell you all the information you're taking in, all the people that think they know it, when you've sat down face to face with thousands of people, help them just like you'd help family, and then answer their phone calls all year long with any issue, well, then you're going to know. You want to trust somebody that knows what they're talking about, and each plan is very specific to each person. Now, you may have a few people on the same plan. I may have a household. Everybody's on different companies. Their doctors, their drugs, their situation, everybody very specific plan. So start with the Medicare Supplement insurance plans. Okay, you'll see the commercials all the time. The grandparents are playing with the kids and riding the bikes. Hey, Medicare doesn't cover everything. The $1,556, the $233, the 20%. Buy our plan and we'll fill in the gaps. Okay, you also hear these plans referred to as Medigap plans. So here you still have your Part A, $0 per month. You're still paying your Part B, $170.10. You still got your drug plan. Okay, you got to have a drug plan, your Part D. Well now, Bobby, hey, I like the sound of the supplement. A friend of mine told me good things. What's the best I can get? Well, the best you can get right now is a Plan G. Okay, and we're going to call it $140 a month. Now these plans you'll see as you're getting everything in the mail or your friends are talking to you. Bobby, I see them a lot lower. Bobby, I see them a lot higher. Very specific reasons why, and we're going to get into Medicare Supplements. Medicare Supplements versus your employer plans, Advantage plans. So those are going to be some great videos to come. Plan G, $140 a month. So Bobby, I'm paying for the $170. I'm paying the $30 for the drug plan. Now another $140. What am I getting out of that? Well, now you go to the hospital. You give them your red, white, and blue card. They say, hey, that's great. How do you want to pay this $1,556? You give them your Plan G card. It's going to pay the $1,556. 60, 70 days later, it's going to pay the $1,556 every time. So your hospital coverage is covered. Now, when you go to the doctor, maybe like I said, maybe you get a surgery right up front. They ask for the whole $233. Maybe you go to the doctor, it's $30. Another one's $40, $18, $31. Once you pay that $233, or the $233 is on you. Okay, so you will pay the $233. One time a year, $233 for the year. If you get on March, April, May, well then yeah, it's $233 for that calendar year. After that, you go to the doctor's office, they pull it up, they say, hey, it looks like you've met your $233 deductible. Now you're just at 20%. The plan is going to pay all the 20%. Okay, these are by your insurance companies. You're getting information on them. You're seeing them on TV all the time. Who spends the most money on TV? Insurance companies and drug companies. Okay, this is my world, and I can tell you, these insurance companies, the drug companies, Medicare, you don't want to go out in these rough waters alone. I'll put it that way. So in Medicare Supplement, there's no network. Except Medicare. You got to go where a doctor takes Medicare, hospital takes Medicare. Oh, Bobby, they're leaving Medicare. They're not. I can just tell you they're not. At $300,000 a month, turning 65, coming on to Medicare, these doctors, the smart doctors, if they're retiring is one thing, they're not leaving Medicare. I just don't see it, and I'm looking every day, thousands of clients, hundreds of doctors that we're in touch with monthly, yearly on our clients' behalf. So no network, worldwide coverage. Okay, with Medicare, you don't have anything worldwide. With your supplements, you've got some coverage. Annual rate increases, okay? These are going to go up as you age. Okay, that's a big thing with supplements. Are they going up like this? Or are they going up like this? Okay, we'll get into that. Also known as Medigap. They fill in a gap. These are by your insurance companies. You'll notice the commercials more than ever now. Then you got Medicare Advantage plans. Okay, now these come in a bunch of different forms. HMO, we've heard of those. HMO point of service, POS is one type. PPOs, we've heard of those. PFFS, private fee for service, and then special needs plans. There's also chronic plans, people that have certain chronic health issues. There's Advantage plans specifically for them. And we'll get into these in very, very much detail later. So with Medicare Advantage, you've still got your Part A that's $0 per month. You're still paying your Part B, $170.10 per month. But what happens here, instead of you being just on the government insurance, or maybe 80-20 with the 80-20 with the government and the insurance company, now what's happening is Medicare is contracting the administration of your health care to someone that actually knows how to take care of it and does a lot better job than they would do. So Medicare, take your 170, they're going to pass that right on to the insurance company. Say, here, you handle them. Give them your 800 number, give them your plastic card. We're still Medicare and we oversee all y'all. Bobby has any problem with our Medicare beneficiary not being taken care of by one of these companies, well, Bobby's going to go to Mother Medicare and I'm going to get the situation taken care of. Okay? So they're still in charge. They're overseeing these plans. All the plans have to do everything that Medicare does. So people say, well, I get my free exam on Medicare. Every plan has to give you that. Well, I get glasses after cataract surgery. Every plan has to give you that. Okay? Medicare's contracts with these plans to take care of the Medicare beneficiary. Okay? Now, we know the insurance companies are probably all up in politics and pushing this and pushing that. But I can tell you, in my 12 years now doing this, they're doing a great job. And these insurance companies do a lot better job than what the government would do. Bottom line is this insurance company is getting paid every month, whether you go to the doctor or not. Now, my clientele, I've got some, a lot of doctors, a lot of things going on. And then I got some folks, Bobby, once or twice to the doctor, knee surgery, got a stent, get a cataract surgery. And then I got the clients, Bobby hadn't been to a doctor in 3 years. Oh, I know you gave me that one doctor's name, I still hadn't seen it. Well, insurance companies getting paid every month. And they've got contracts with these doctors and these hospitals. Okay, back 2010, Bobby, these Advantage plans are going to go away. No, they're not. Okay, they're great. Medicare is subcontracting a very important part of your retirement to the insurance companies that have the deals with these hospitals and these doctors. Well, Bobby, nobody likes them. No, all your major hospitals. Where I'm at in Sugar Land, Fort Bend County, Harris County, Montgomery, Brazoria, thousands of doctors that welcome the plans. But it's very specific per person, and we're going to get into a lot deeper detail, HMOs, PPOs, versus supplements in some future videos. So now, with these HMOs, what the insurance company will do, they'll say, well, listen, we're going to take all your hospital coverage, all the Part A, all your doctor coverage, Part B, add in all the drug coverage so you don't have a separate card there, call it Part C. So when you're hearing, hey, Bobby, do I have Part C? I thought I had an Advantage plan. It's the same thing. Part C is an Advantage plan. Your A, B, and D all together, Part C. All in one card. Okay, really just like you're used to an employer card. I don't know, Bobby, doctor, pharmacy, hospital, one card. So now you have HMO, PPO. Okay, like I said, you've got some different ones, but basically HMO, PPO is where we're going to start. Health Maintenance Organization. Okay, it's an organization that is put together to help you maintain your health. We want to have a primary care doctor that we know can be the one that refers you out. Okay, no problem with this, not in this day and age. Okay, especially with great doctors. Refers you out, everybody checks, make sure you're on the right drugs. We're taking steps to keep you healthy, get your annual checkup every year. You've got referrals. PPO, preferred provider. Hey, we've got thousands of doctors around here. You don't need referrals to go see your specialist. And even if you can't find a doctor here, well, Bobby, I got that doctor in Dallas. He did my left knee. I want him to do my right knee. I don't see he's in network. You can even go out of network and see doctors out of network, okay? But there's some disclaimers to that we'll get into in our HMO PPO comparison video. So now, you don't have no deductible to hospital, no deductible that's $233 on most all of the plans here in Fort Bend, Harris, Brazoria, Montgomery, Galveston. Now you're just going to pay copays. So Bobby, hey, I got my card. Monthly premium on this HMO zero. You see these plans are zero. When I first started 2010, my mom was 80, 91 now. The most awesome woman. 91 now. She was on this HMO, zero per month plan. I said, oh gosh, you know, her husband calls me, Bobby, hey, your mom's about to go wring the neck of an insurance agent. My mom, she 4 foot, nothing, 38, snub nose. She one tough woman, okay? I'm thinking, oh gosh, some insurance guy's going down. I get with one of the ladies in the firm that had been doing Medicare for years, says, no, Bobby, these insurance companies are getting paid every month. They don't need to charge you, okay? They got to compete with the others. They're fine with everything they get, and they're going to take great care. It's finding her doctors, her drugs, the nuances of the different plans to find that right fit. You know, and just what I've done with thousands of applications now. So you pay copays, your HMOs are zero. PPO maybe 0 to 50 per month. Okay, I'm gonna give a little wide range here. Primary care, $0 to $15, okay? Medicare's big push, get the folks into the primary care doctor. Medicare's numbers show them the folks that get in to see a primary doctor once a year and get that full test done. Not the doctor sitting on the computer and and figuring out which drugs don't match up, but the head to toe, put the scope on you, talk to you, spend some time with you, a long visit. Those folks are less likely to pick up all these diseases that cost the insurance companies and Medicare all the money. So it's a big push. So primary doctor, zero. Most of these plans, labs are zero. X-rays, $0 to $15. Hey, we don't want you having that twisted ankle. Now you don't want to spend the $60, $80 to go get an X-ray, so you don't get it done. Next thing you know, it's a knee problem, it's a back problem, you can't exercise, it's a weight problem, now it's a heart problem. Okay, they want you to get in and get taken care of. Specialists, maybe $20 to $50, okay? Outpatient surgery, there's some plans it's a flat $100. Well, Bobby, I got to get the cataract surgery. What about deductible? No deductible, flat $100. Maybe up to $400 flat. Okay, and we're talking HMO, PPO, 14 different companies, 60 different plans in my area. Okay, not to mention all my clients all over Texas. Hospital, you got some plans, it's a flat $350 per stay. Well, Bobby's in there 9 days, $350. Bobby, I go in there 3 days for that back surgery. Everybody says thousands of dollars. No, $350. Bobby, they kept me overnight. Looks like I'm really healthy. $350. Well, Bobby, how do they do that? Because Medicare knows the national average 2 days in the hospital. Medicare beneficiary. That means when Joe down the street was in the hospital for 2 weeks, nobody else on the street goes for 2 years. Some kind of odds like that. Medicare knows the odds. The plans know those odds. That's why they can put that out there. On the high side, you may have a plan, well, no, it's $395 a day, $400 a day for the first 6 days. You know, so you're $2,500 in exposure there. And then zero after that. Well, she's in there 9 days. Oh, she's going to pay about $2,400 on that plan. Well, she was on, my uncle's got that other plan. Oh, he was $325 for the first 5 days and then zero. Well, that one plan, you $350 flat, okay? So you've got some hospital coverage. Here in our area, Memorial Hermann, Methodist, St. Luke's, West Houston, okay? These places are taking the plans. Because they've got money left over and they want to compete, which is the beauty of it, let them compete. I want them to beat each other up, okay? To me, it's not the insurance company. It's which one's going to be the best for my client, and I'm going to hold their feet to the fire on every benefit in that book for the year. We're going to make sure my clients maximize everything in their plan, everything that they're paying into Medicare. If they're paying a little bit here and there on maybe a PPO, we're going to get every penny squeezed out of it. Okay, so now they got extra money, so hey, we'll give you some dental, glasses, transportation to and from the doctor, hearing aid coverage, some rewards. Hey, you go to the doctor and go to your little portal, show us you're exercising. We're going to send you a gift card. Hey, go to your primary doctor, get that checkup, we'll send you a gift card. Okay, they're interested in helping you maintain your health. And they'll pay to do that because they're going to look back at Medicare and say, hey, Medicare, hey, keep paying us. We're taking good care of your Medicare beneficiaries. Okay, and I've watched this for 10 years. That's why I'm invested all in this industry. And not that I'm going to get a ton more clients from these videos, but just an advocate for my clients to get on the right plan for the right reasons every year. And then hopefully you've got an agent and a team that every little service issue, every bill, every doctor, every drug price, we're looking over every bit of it and make sure we're doing same thing I do if one of my aunt or uncle called. Bobby, you better get this handled. going to come down and I know you will, and I'm going to get it handled. So you got the extra benefits over the counter. You hear about this. Well, wow, they sent me this catalog. Told me $35 a month. I go in the catalog, I go online, get some Band-Aids, vitamins, some aspirin, some cream, some ointments. They send it right to my door. Okay, they're wanting to keep you healthy. Okay, we're going to get into each of these in a little bit more detail, because especially these items here, we want to squeeze everything out. Bobby, is a supplement or advantage plan best for me? Well, I may have a husband on advantage and a wife on supplement. Well, Bobby, that's straight. No, they're doctors, they're drugs, their situation. Okay, I'm going to get you the education. I'm going to let you know what it takes for enrollment. If you're in Texas, I can be your man, and I know agents all over the country that can help you just like I do. And then we're going to show you what Service for Life looks like. And even in these videos, for the folks that aren't my clients, I'm going to show you how to maximize your plan. I'm going to show you how to keep from being taken by doctors, labs, shady commercials. And my business will thrive for taking care of the folks, and I'm glad to. As has been my mindset since 2010. You're all aunts and uncles. My aunts and uncles love me and I love them. They will come put their hands around my neck. If Bobby, make this smooth, make it easy, make it simple, and that's exactly what I do. Thank you for staying tuned. Take a screenshot of this, and we're going to get back into some great detail in some future videos. Thank you, and tell a friend. Before you go, a couple of things. I know in the video, 10 years, 12 years, 10 years, 12 years, I've been doing Medicare since 2010. All I do is Medicare, no other types of insurance. Also, there's some other videos I want to make sure you check out. Very important. IRMA, income-related monthly adjustment amount. If you're making a higher income, you may pay more than the 170.10. I'm going to show you all about it. Lifetime penalties on your Part B and your Part D. I'm going to show you how to avoid those. Your drug plan, very, very important. It's a whole different world on your drugs on Medicare than what you've seen on employer plans and your past plans. We're going to do two videos, one on your basics of the RX plan, and then also on the donut hole, also known as the coverage gap. We're going to go over Medicare Supplement versus Medicare Advantage. Bobby, what's right for me and why is it right? HMO versus PPO plans, and then also your extras. We want to make sure you squeeze everything you can out of your plan this year. Thank you for watching. We look forward to seeing you back.
Call 832-788-9888 to set up a free, no-obligation consultation with a MetaPlan Max agent in your community to see if you qualify for a special enrollment period.